Now, what happens after an extraction of a tooth normally is that there is some resorption and remodeling of the area that happens. Occasionally, the sinus, which is located directly on the top of the upper back teeth, starts to migrate down. And this migration can happen in various forms in different people and to various extensions. And of course, after a few months of healing, one can have a minimal amount of height of bone in that region due to the consistent and continuing bone resorption. Now, in order to provide any type of implant support for prostheses, it is very important that we have an adequate height of bone which allows us to place ideal size implants. Short implants in this region of the jawbone have a high failure rate. Therefore, it is extremely important to augment and reestablish the height of vertical bone required to support ideal size implants. So in this situation, as we see, this would be a normal amount of bone, height of bone to support ideal size implants. And here we can notice that the sinus has migrated down and there is inadequate height of bone for this process to occur. Now, this is a very conservative procedure and very predictable procedure, which I refer to as vertical bone enhancement of the upper jaw area. And it can be done either as a single stage along with the placement of the implant, or in situations like this where we have very small or amount of height of bone in the upper jaw, we would have to do a double or two-stage procedure. In this case, we actually create a very conservative window where we can elevate the membrane of the sinus and place some graft material in its position. This graft material is allowed to heal and consolidate over a 6-month period, during which case it becomes solid bone. At this point, we can place an implant to ideal size and orientation to give us the type of support that we require for the crown placement. In another situation, if we have some more vertical height of bone, we might be able to position the implant and do the grafting at the same time, and this is known as a single stage procedure. In this case, we create our small window and place some bone graft material in the pocket that's developed in the sinus region. At the same time, we can place our implants and the graft around them, and we allow everything to heal and consolidate over the next 5 to 6
Here's
months.
an example of a patient with about 3 to 4 millimeters of height of bone in the right maxillary area, who was treatment planned for placement of 2 implants, and a double stage or 2-stage sinus graft procedure was planned. Okay, so the procedure starts with a crestal incision and a full thickness flap exposing the lateral aspect of the maxilla. Osteotomy is done using a round diamond burr, being careful not to penetrate or perforate the sinus membrane. The lateral wall of the maxilla is eventually infractured, and using a number of elevators, the sinus membrane is carefully peeled and elevated away from the bone and moved superiorly, creating a cavity or space where the bone graft can be placed. It's very important to avoid tearing of the membrane in this stage. Autogenous bone was harvested in this case and mixed with PRP and BioOs as grafting material. This bone complex was then grafted by placement into the cavity sinus created earlier, with the sinus membrane folded superiorly and the innate bone below. Membrane was placed over the graft and closed primarily. 6 months later, the bone is healed. A surgical guide was used for positioning of the implants. Osteotome can be used for further condensing the bone for better stability of the implants. Subsequently, 15 millimeter implants were placed into sites number 2 and 3. and closed primarily and allowed to heal for another 4 months prior to exposure and placement of 2 crowns on the implants.